So these are graphs to show you what the distributions look like for this. So on the left, we have the total length of stay. So this is just showing the overall distribution of people in the ICU. So we see that most of the patients are fairly short stay patients, and then we have a long tail of longer stay patients. So the short stay patients tend to be surgical patients that have maybe they've had a complication during their surgery, or maybe they're just admitted to the ICU just for some extra ventilation, or maybe they've lost quite a bit of blood, and they just need that extra monitoring that the intensive care unit gives you to make sure that they're recovering. And typically those patients are much healthier. They might be younger because often if you're doing a surgery on a patient, you need to make sure that they're healthy enough to recover. And then you have these longer stay patients, which could be a whole range of things. And these are typically a lot more complicated, and they may be older as a population. This would be where you'd find your coronavirus patients. They tend to stay around 8 to 10 days. So they're very much at this, the flatter part of this distribution here. And this is really, you know, the patients that we're going to want to be able to predict well, if possible. And then on the right-hand side, this is showing what it looks like if you take the remaining length of stay. And the reason why it's more positively skewed than the total length of stay is because if you had, say, a patient who stays for 10 days, there will also be some point during their stay when they have less than 4 hours left in their stay. So that will then contribute to the buckets on the left side of that graph there. And having a positive skew this severe in the labels that we want to predict isn't very ideal for machine learning. Ideally, we'd want to be predicting something that's more of a Gaussian or a normal distribution. But I'll talk a bit more about that later on in terms of what we did to try and mitigate for that.